Bismillahirrahmanirrahim. Assalamu alaikum. This is Falak Rizvi, roll number EP1770034. My group topic is CNS infection and my subtopic is meningitis. So before starting my topic, I want to mention that all the data I have collected from a book Applied Therapeutics, the clinical use of drugs, 9th edition, and internet resource. So I want you to have a quick review of anatomy and physiology of brain. So first I will discuss meninges. Meninges is basically a protective covering and is suspended in CSF, which is a shock absorber to outside trauma. And meninges usually consist of three fibrous tissue layers. Number 1, pia mater, number 2, arachnoid mater, and number 3, dura mater. Second, we have CSF, means cerebrospinal fluid. It surrounds brain and spinal cord, and it is a colorless clear body fluid. CSF is produced and secreted by the choroid plexus in lateral ventricles and lesser extent by the choroid plexus within the third and the fourth ventricles. Third, we have is BBB, means blood-brain barrier. It plays a crucial role in protecting the brain and the maintaining homeostasis within the CNS. And it is a high selective semi-permeable border, and it prevents solutes in circulating blood from non-selectively crossing into the extracellular fluid. Now, what is meningitis? Meningitis is basically an inflammation of meninges, the membrane, and fluid surrounding brain and spinal cord. Meningitis is the most common type of CNS infection. So usually bacterial meningitis are acute in onset and involving over a few hours. In contrast, a diverse group of infectious like viruses, fungi, mycobacteria, and non-infectious like chemical irritant agents produce a meningitis picture, often of a less acute or chronic nature. Now, what are the types of meningitis? So, commonly we have viral meningitis, bacterial meningitis, fungal meningitis, parasitic, and non-infectious meningitis. So, first I'll be discussing bacterial meningitis. Bacteria can reach to brain and spinal cord through bloodstream and causes acute bacterial meningitis. And secondly, bacteria can also invade meninges directly, and this may be due to ear or sinus infections, skull fracture, or by surgeries. So now, who can get this bacterial meningitis? Neonates and infants that are less than 1 month, infants that are greater than 1 month, and children that are less than 4 years, and adults. So what are those bacteria that are causing bacterial meningitis in neonates and infants that are of age less than 1 month are Group B, streptococci and coliform organisms like E. coli. And what are those bacteria that are causing bacterial meningitis in infants that are greater than 1 month and children of less than 4 years are Streptococcus pneumoniae, Haemophilus influenza, and Neisseria meningitidis. And what are those bacteria that are causing bacterial meningitis in adults are Streptococcus pneumoniae, Neisseria meningitidis, and Listeria influenza. So here I'm discussing some most common strains of bacteria which I have already mentioned, like Streptococcus pneumoniae. And Streptococcus pneumoniae, as you can see, is involved in all types of age group, in neonates, in infants, in adults, in children, and it is the most common cause of bacterial infection in United States. And it more commonly causes pneumonia or ear or sinus infection. Next, I'm discussing Neisseria meningitidis. So this bacteria commonly cause an upper respiratory infection but can cause meningococcal meningitis when they enter bloodstream. Third, I'm discussing Haemophilus influenza. It is a Haemophilus influenza type B bacteria was once the most leading cause of bacterial meningitis in children, but new HIV vaccines have greatly reduced the number of cases of this type of meningitis. In the last, I'm discussing Listeria, and this bacteria can be found in unpasteurized cheese, hot dogs, and lunch meats. And pregnant women, newborns, and older adults and people with weakened immune system are most susceptible. Now, viral meningitis. So viral meningitis is usually mild and often clears on its own, and most cases in the United States are caused by a group of viruses known as enteroviruses, which are most common in late summer and early fall. and meningitis caused by viruses, and these viruses are herpes simplex virus, HIV, mumps virus, and West Nile virus. Now, fungal meningitis. So, fungal meningitis is relatively uncommon, and it's life threatening if not treated with an antifungal medication, and it may mimic acute bacterial meningitis. It's often contracted by breathing in fungal spores that may found in soil, in decaying wood, in bird droppings. And cryptococcal meningitis is a common fungal form of the disease that affects people with immune deficiencies such as AIDS. And fungal meningitis is not contagious from person to person. Next is parasitic meningitis. So parasites cause a rare type of meningitis, and that is eosinophilic meningitis, and usually people get affected by parasitic meningitis by eating foods that are contaminated with parasites. And parasitic meningitis caused by Angiostrongylas cantonensis, Baylisascar procyon and Gnathostoma spinningur. And amoebic meningitis is a rare type that is sometimes contracted through swimming in fresh water and quickly become life-threatening. The main parasite that causes meningitis typically infect animals, not humans. Now, in the last, non-infectious meningitis. So, non-infectious meningitis is not an infection. Instead, it's a type of meningitis that's caused by other medical conditions or treatments. And these includes cancer, brain surgery, medicines, lupus, heart surgery, and any other issues. Now, what are the signs and symptoms of meningitis? So here I'm just discussing generalized signs and symptoms. So it could be vomiting, it could be fever, headache, confusion, sleepy state, seizures, distracted lights, and rashes. Now, what are the preventive measures we can take for meningitis? So, wash your hands, means careful hand washing prevents the spread of germs. Practice good hygiene, means don't share drinks, food, straws, eating utensils, toothbrushes with anyone else. And stay healthy, means exercise regularly, eating a healthy diet, and maintain your immune system. And if you're pregnant, then take care with food. Now, what are the treatment strategies? What are the treatments for bacterial meningitis? It includes, according to age groups, like neonates that are less than 1 month, we can give cefoxitisome plus ampicillin and gentamicin plus ampicillin. And for infants that are 1 to 3 months old, we can give cefoxitisome plus ampicillin plus vancomycin and ceftriaxone plus ampicillin plus vancomycin. And for the children that are age of 3 months to 18 years, we can give ceftriaxone plus vancomycin and cefoxitisome plus vancomycin. And adults of age 18 to 50 years, we can give ceftriaxone plus vancomycin. And adults that are greater than 50 years and those people who are alcoholics, so in these we can give ceftriaxone plus vancomycin plus ampicillin. Now, treatment strategies for viral meningitis. So herpes simplex virus, varicella zoster virus, and cytomegalovirus have a specific antiviral therapy. And for herpes, the treatment of choice is acyclovir. And if encephalitis is suspected, then empiric treatment with IV acyclovir is often warranted. And surgical management is indicated where there is extremely increased intracranial pressure, infection of an adjacent bony structure, and skull fracture or abscess formation. And the majority of people that have viral meningitis gets better within 7 to 10 days. So the question is that, is there a vaccine for meningitis? And the answer is yes, there is. And there are 2 primary vaccines for meningitis and are of bacterial causes, and I'm discussing only these 2 here. Other vaccines are also available, and these 2 vaccines are meningococcal conjugated vaccine and MENB. So first I'm discussing meningococcal conjugated vaccine, and the CDC recommends that a single dose of meningococcal conjugate vaccine could be given to children ages 11 to 12 with a booster shot given at age 16. And if the vaccine is first given between ages 13 and 15, the booster is recommended between ages 16 and 18. And if the shot is given at age 16 or older, no booster is necessary. And this vaccine can also be given to children between ages of 2 months and 10 years who are at high risk of bacterial meningitis, or who have been exposed to someone with disease. And it's also used to vaccinate healthy people but previously unvaccinated people who have been exposed in outbreaks. Now MenB targets one specific strain, and its protection window is much shorter. Only certain populations are recommended to get this vaccine. Now onwards, I'll be discussing case study for meningitis. A baby with meningitis. This is the case study. So Catherine is a mother of 2 young children who comes to pharmacy and asks for advice. She has a young baby, Jacob, who is 6 weeks old, and Isma, who is 4 years old. And Jacob has a blocked nose and fever. And Catherine explains that Isma has a gastroenteritis with cold symptoms and fever last week, but no rash. So Catherine is worried about Jacob and asks for advice. So here we are discussing a case study regarding Jacob, who is 6 weeks old and is having blocked nose and fever. Now soap note. What is the subjective and what is the chief complaint in this? Chief complaint which Jacob is having is blocked nose and fever, and gender of Jacob is obviously male, and age is 6 weeks. Now objective is that Jacob is having rash on his stomach and back. Rash looks like red blotches and does not fade with the class test. And Jacob has been more unsettled than usual and does not want to feed as much as normal. Now what would be the assessment? So Catherine brings her children into the consultation room for further assessment, and Jacob has been more unsettled than usual and does not want to feed as much as normal, as we have already discussed. And upon examination, Jacob has a rash on his stomach and back, which his mother says was not present this morning. And his rash looks like red blotches and does not fade with the class test. So owing to his age, Jacob is too young to have received any vaccination. Means उनकी मदर का ये कहना है कि जैकब को मॉर्निंग में ये रैशेस वगैरह की परेशानी नहीं थी, पर उस वक्त जब एग्ज़ामिन किया गया डॉक्टर्स के थ्रू तो ये पता चला कि जैकब के स्टमक के ऊपर रैशेस हैं और उसके बैक पे रैशेस हैं. सो व्हाट वुड बी द डायग्नोसिस? डॉक्टर्स क्या डायग्नोस करेंगे? It is important to remain calm and inform Catherine that you think Jacob have meningitis. तो डॉक्टर्स को ये बताना है कैथरीन को कि मे बी जैकब को meningitis हो, क्योंकि कैरेक्टरिस्टिक रैश है. एज वी हैव ऑलरेडी डिस्कस दैट साइन एंड सिम्टम्स ऑफ meningitis include रैशेस. सो कैरेक्टरिस्टिक रैश है जैकब के स्टमक और बैक पे, as well as other known symptoms, and Jacob needs to be taken to hospital for emergency assessment and an ambulance is called. Now what would the treatment strategy? What would be the plan? So on arrival at the hospital, Jacob has blood test taken and a lumbar puncture. ये 2 टेस्ट कर लिए गए, lumbar puncture कर लिया गया और blood test ले लिया गया. And he is started on IV cefotaxime with amoxicillin, and IV ceftriaxone would be administered with full volume and maintenance fluids and enteral feeds as tolerated. And corticosteroids must not be used in children aged younger than 3 months with suspected or confirmed bacterial meningitis. Means हम एमॉक्सिसिलिन और सेफोक्टाक्साइम देंगे जैकब को, लेकिन उससे पहले जब तक हमें कंफर्म नहीं हो जाता कि मेनिंजाइटिस है या नहीं है, उससे पहले हम किसी भी किस्म की कॉर्टिकोस्टेरॉइड थेरेपी नहीं दे सकते. जो 3 मंथ्स के बच्चे हैं या उनसे बड़े हैं उनको हम नहीं दे सकते. सो जैकब हैज़ अर्ली ऑब्जर्वेशन initially for heart rate, for blood pressure, for respiratory rate, oxygen saturation, fluid balance, and Glasgow-Coma scale. And this Glasgow-Coma scale is a neurological scale used to describe the level of consciousness in a person following a traumatic brain injury. The lower the number, the more severe the brain injury. Means जितना कम GCS का लेवल होगा उतनी ज़्यादा चांसेस होंगी कि ब्रेन सर्जरी ज़्यादा होगी. और फिर पब्लिक हेल्थ इग्नेंट ने भी कंफर्म कर दिया कि जैकब को मेनिंजाइटिस है. तो हम जो ट्रीटमेंट स्ट्रेटजी अपनाएंगे वो ये होगी कि हम सेफोक्टाक्साइम और एम्पिसिलिन देंगे. Now these are the references which I have included from internet resource. Thank you very much.